Section 1. Introduction. Your high-yield path to NCLEX respiratory pharmacology success. Mastering respiratory medications is a critical step for every nursing student aiming to conquer the NCLEX. This knowledge is not just about passing an exam. It is the bedrock of safe and effective patient care. When a patient struggles to breathe, your quick informed actions can make a life or death difference. This guide is specifically designed to provide a high-yield, focused review of the most essential respiratory drugs you will encounter on the test and in your future practice. The goal here is simple: to build your confidence. By focusing on quick recall of the most important facts for each medication class, ensuring you are prepared for whatever questions come your way, we will systematically break down each major category of respiratory drugs: common allergy medications, powerful bronchodilators, anti-inflammatories. The approach is straightforward and tailored for easy memorization. Instead of overwhelming you with exhaustive details, we will concentrate on the core information that the NCLEX prioritizes. Understanding what each drug is used for, recognizing its most common and dangerous side effects, knowing who should not receive it, identifying the key nursing considerations and patient education points. Section 2. Clearing the air. Allergy and cold medications unpacked. Quick visual. Common allergens and someone sneezing. Antihistamines, diphenhydramine, Benadryl is a classic example. Their primary use is to treat allergic reactions, rhinitis, itching, hives. They work by blocking histamine receptors in the body. Beyond allergies, these drugs can manage motion sickness or act as a short-term sleep aid. Warning: effectiveness comes with notable side effects. The most prominent is drowsiness, can impair alertness, dry mouth, blurred vision, constipation. Urinary retention: these are important for the nurse to monitor. Contraindications: start with narrow-angle glaucoma, benign prostatic hyperplasia causing urinary retention, and a known allergy to the drug. Nursing responsibilities focus on safety. Assess alertness, implement fall precautions, and teach patients to avoid driving, avoid operating heavy machinery, and avoid alcohol while taking the medication. Section 3. A closer look at antitussives. Opioid antitussives include medications like codeine and hydrocodone. They are prescribed for the suppression of a severe non-productive cough. They work directly on the cough center in the brain to reduce the urge to cough. Reserved for coughs that are debilitating, painful, or prevent rest. Risks include serious side effects. The most serious is respiratory depression. Other side effects: sedation, constipation, and nausea. Contraindicated in severe respiratory depression or acute asthma attack unless closely monitored. Use extreme caution with head injury or increased intracranial pressure. Nursing: frequently assess respiratory rate, depth, rhythm, and level of consciousness. Monitor bowel function. Consider a stool softener to prevent constipation. Teach patients to avoid alcohol and other CNS depressants. Dextromethorphan is a widely available non-opioid antitussive for a dry, hacking cough. It acts on the cough center but lacks opioid analgesic or euphoric effects. Side effects are usually mild: dizziness, drowsiness, GI upset, but high doses can be abused. Beta-adrenergic agonists are the cornerstone of acute asthma management. Albuterol is the most well-known example. These are rescue inhalers. They provide rapid relief during asthma attacks or COPD exacerbations. They stimulate beta-2 receptors in the lungs, causing airway smooth muscle to relax and airways to dilate. Predictable side effects: tremors, nervousness, tachycardia and palpitations, headaches. Use caution with cardiac arrhythmias and severe uncontrolled hypertension. Avoid if allergic. Nursing: teach proper inhaler and nebulizer technique. Assess breath sounds and respiratory rate before and after. Check oxygen saturation and monitor for significant increases in heart rate. Anticholinergics like ipratropium offer another bronchodilation route. They block the parasympathetic system to prevent airway tightening. Used for asthma, but more commonly maintenance therapy for COPD. Side effects: dry mouth, cough, headache. Watch urinary retention in older men. Contraindication: allergy to atropine. Caution with narrow-angle glaucoma and prostatic hyperplasia. Nursing, rinse mouth after use, encourage fluids for dry mouth, monitor urinary output. Inhaled corticosteroids like beclomethasone are fundamental for long-term control of persistent asthma. Their primary role is not immediate relief but to reduce and prevent airway inflammation over time, making airways less sensitive to triggers and reducing frequency and severity of exacerbations. Side effects are typically local: oral candidiasis, hoarseness, and a dry mouth. With high doses or long-term use, some systemic absorption can cause adrenal suppression or hyperglycemia. Contraindicated with active systemic fungal infection. Not for acute relief, use a rescue inhaler for attacks. Nursing, teach correct inhaler technique and recommend a spacer to improve lung delivery and reduce oral deposition. Instruct patients to rinse and spit after each use to prevent thrush. Leukotriene modifiers such as zafirlukast are used for long-term asthma management. They block leukotrienes, inflammatory chemicals released during allergic responses, to prevent airway constriction and swelling. They are taken orally on a regular schedule to prevent symptoms. Side effects: headache, stomach pain. Monitor for increased liver enzymes. Contraindicated in active liver disease. Use caution with liver dysfunction. Interactions can increase warfarin effects and bleeding risk. Nursing, ensure periodic liver function tests and teach that this is a controller, not a rescue drug. Follow specific administration instructions, such as taking on an empty stomach if required. The key to NCLEX success is rapid, accurate recall under pressure. Use this final pre-exam cram sheet and review it repeatedly. 1. Diphenhydramine causes significant drowsiness. Avoid driving. Watch fall risk. For more information, visit www.brispainternational.com.